my next guest here on Morning Rush is a pediatric surgeon, which of course is all about children, so I love her a lot. But the Surgical Society of Zimbabwe will be celebrating their 30th anniversary in Gweru on Friday the 19th of July. Now to mark this, listen to this guys, they will be giving free surgical consultations to the public, and they will be performing free surgical operations. I'm now joined by Dr. Simukai Mache. Oh, sorry, I lied. My mistake. He couldn't come. Dr. Precious Mutambanengwe, the Secretary General, who's also a pediatric surgeon. She's Secretary General of the Surgical Society of Zimbabwe. Precious, thank you for coming on to Morning Rush and welcome. Right, tell us, 30th anniversary. That means 30 long years. Tell me a bit about that. And is this a special celebration? Tell me a little bit about the celebration itself.
Of course, 30 years is a big deal. The Surgical Society was formed in 1994, and we've been going strong since then. We mainly focus at surgical care for the people of Zimbabwe, but on top of that, we're into the training of medical students, of future surgeons, of nurses, and we work with our sister associations such as the Zimbabwe Association of Anesthetists, whom we would not be able to do our work without. Yeah. And for this year, because we understand how the community helps us be the surgeons that we are, we want to give back. And by that, we're going to be doing the free consultations and the free surgeries.
Tell us about that. Free consultations, free surgeries. So when you say free surgeries, obviously there's so many surgeries. I mean, I'm sure some you possibly couldn't do because they're really like sort of long lifetime, or are you going to do everything? Well, what are you actually going to do when you say free surgeries?
All the specialties in the Surgical Society have volunteered representatives to offer their services. So on the Thursday, we're going to do screening and to see which cases are good candidates.
That's Thursday the 18th.
Thursday the 18th.
So what happens is that people can come to, where do they come to Gweru? Where do they come in Gweru?
They go to Gweru Provincial Hospital.
Okay, they go to Gweru Provincial Hospital.
Yes.
They go there on the Thursday to be screened.
But they can actually start going there now. We have surgeons on the ground who are doing some of the screening, and they'll shortlist the patients that are good candidates for our camp.
I think that's important, guys. Go there now, because if you go there on Thursday or Friday, you can imagine there'd probably be huge queues. But if you go now, you can be screened earlier and hopefully maybe get a free surgery if you need one.
That is correct. Time, obviously, is going to be a constraint. We won't be able to operate everyone, but we will be running clinics where we screen the people, see people with different conditions, those that cannot be operated on. They will be given some treatment and then reviewed or referred to hospitals where they can get the surgery.
So the free operation's only on the Friday. So if you don't do everybody then that's that. You won't be doing free after that, is it?
No.
But they still can. Obviously, they'll now know what the issues are. They know what the treatment they'll require.
Exactly.
Now, I mean, I know the guest of honor will be the First Lady. I mean, that's excellent. I know that she is such a proponent and supporter of initiatives that help citizens, I think. I think that's the only way I can describe her thing. So that must be quite an honor for you.
Yes, it is. Over the years, the First Lady has been a huge supporter of especially health and the vulnerable. I know in recent years, she helped renovate the maternity hospital at Harare Hospital. And we've seen her donating to numerous people all across the country. So having her with us at our celebration as we give back, it's a big deal for us.
Now, I know that your society is also obviously in the forefront of equipment, trying to get equipment into hospitals, because of course that is one of our shortfalls, particularly in public hospitals, lack of equipment to deal with certain. In fact, there's two issues that I always like to talk about: lack of equipment and the high cost of drugs. I think those are the two issues. What are you guys doing? Are you sort of getting involved with the Ministry of Health and Child Care? Because obviously there may not be enough equipment, particularly in provincial hospitals or hospitals around the country. In urban centres, it's a bit better, I think. You know better.
Yeah, that is true. Thank you for asking that. As a surgical society, we're partnered with the government, and we launched what we call the National Surgical Obstetric and Anesthetic Strategy.
Whoa, it's a mouthful.
Yeah, it's a mouthful. We call it ENSO.
Oh, that's thank you.
For short.
Thank you very much.
So part of that program is we're trying to deliver better surgical, anesthetic, and obstetric care to all the people of Zimbabwe. And it also involves equipping mainly the district and provincial hospitals so that we can provide better care. And then having good equipment is never enough. You need the people to operate the good equipment. So we have seen a lot of decentralization of our surgeons. We now have orthopedic surgeons and general surgeons in almost every provincial hospital.
Are you able to hold on to them? I mean, sorry, I'm talking about the brain drain here, because of course, for someone who's a pediatric surgeon, for you to be offered a job in the UK is like yesterday. Are you finding a lot of brain drain in that? Is that hampering us in terms of our surgical ability?
Just like all the other sectors, we have faced brain drain. One of the advantages that we've had is we have a local, not local per se, but we have a local branch of a regional college called College of Surgeons of East, Central and Southern Africa. And in their studies, they noted that people who train in their own countries are more likely to stay. And over 75% of people who specialize with that college stay within their member countries. And we're seeing the same for Zimbabwe.
I mean, we have incredible surgeons all around the world. I know they're doing leading, cutting-edge surgery. But even here in Zimbabwe, I mean, we recently reintroduced open heart surgery.
Yes.
I mean, talk to me about that, because, I mean, that is... Wow. I mean, that's fantastic. And I always say to people, guys, you know, we always think, let's go out of the country somewhere else for surgery. But I tell you now, our doctors, you're probably going to go to another country and find a Zimbabwean doctor operating on you. That's how good we are in terms of surgery. Yeah, it's silly, isn't it? Yeah. I mean, in fact, someone was telling me to go to South Africa. I found that the name of the doctor was a Zimbabwean. So I was like, well, why am I going to South Africa and paying rand? But tell me about this open heart surgery and some of the sort of cutting-edge surgeries that you guys are doing.
Recently, we reopened open heart surgery. Before, it had been in the country, but it had been affected by the lack of consumables, because the consumables that are used are very, very expensive. But we've reintroduced it, and we have the first female cardiothoracic surgeon who was trained in South Africa but came back to Zimbabwe.
Oh, right. She's the first.
From Zimbabwe.
From Zimbabwe.
Yes. Oh, cool. So you see, people have brain drain, but we have people coming back and actually offering the services. Her name is Ms. Kudzai Kanyepi.
Oh, right.
So yes, brilliant. She's with the team at Pari, and they're offering...
I know, I take my hat off to you guys. You know, you always say that when you need a surgeon, they're there. And I know in Zimbabwe, the surgeons work very hard. So this is the Surgical Society of Zimbabwe. So just to explain to us exactly what's happening when you're doing the day anniversary, 30th anniversary.
So we're kicking it off with our outreach, which is when we're going to be doing the clinics and seeing people.
Which is from today?
No. From today, it's basically just screening.
So today you can go now to Goa Provincial Hospital and get screened, right? So please start going today if you're in the area.
Yes, please, so that you avoid the rush.
Yeah, exactly. Because there will be a rush, 100%.
And then on Thursday, we'll be operating on some children, pediatric hernias. There's a huge backlog in that area, so we decided to dedicate a whole day just for the children.
I think people don't understand how lucky we are not to have some of these ailments. You know what I mean?
True.
And I think it's important that we know about them and support those who are ill. Right, so Thursday you do a few operations and, of course, continue the screening.
Yes, and then on Friday is our main day when we'll do most of the clinics, the big clinics where we see everyone who shows up. And then...
There'll be an event, of course. When is the event? And where?
The event is on Friday night. We'll have a big celebration dinner.
Where? In town?
Yes, in Gweru.
Okay, in Gweru.
Yes, in Gweru. We'll have... we'll be honouring all our surgeons, past, present, and current.
That's nice.
And all those who've made a huge impact in the surgical society.
And, of course, First Lady will be the guest of honour.
Yes.
Okay. Well, there you have it. All roads lead to Gweru. So all of you, please start going today. Start from today. Going to Gweru Provincial Hospital to start the screening process. Don't beat the rush. Thursday, you can still do it. Friday, the operating on. But Surgical Society of Zimbabwe, 30th anniversary in Gweru, this Friday, the 19th of July. Dr. Precious Mutambanengwe, thank you. Precious, it's been a pleasure. Thank you so much. Keep up the good work. Wow, she's got great hands for surgery. I don't know why you always look at people's hands. Well done. It's a pleasure.
Thank you for having me.
Konapo. Ipapo pa ZTN Prime. DSTV channel 294. The place to be.